Can you tell me about a time where you recognized adverse changes in your patient, especially your patient's condition, and how you responded?
The time that I noticed an adverse reaction in a patient is when I was working in a medical ward long time ago, and I was looking after a patient who was suffering from COPD, chronic obstructive pulmonary disease, and which is a progressive disease of the lungs, which causes the airways to narrow. That day, the client wanted to go to the toilet and he had a fall. I quickly assessed his environment and his body, and he seems to be okay. No injuries had occurred. And I asked him if he was fine, and he said he was okay. So I quickly called my colleague to help me to hoist him to bed, and quickly I positioned him comfortably in a semi-Fowler's position, for he was now showing the signs of dyspneic, difficulty in breathing. The patient was dyspneic, that means he was having difficulties in breathing. I called in for the doctor. Whilst I called in for the doctor, I started doing vital observation such as oxygen saturation and respiratory rate to see the condition of the patient and the effectiveness of the patient on the position that I have put him in. Before the doctor showed up, the patient was already improving because he had only occurred the dyspneic because of the fall.
Thank you, Betty. Now my next question, what is work health and safety? And can you give me an example of your application of work health safety in clinical practice?
I can say work health and safety is protecting the health and ensuring safety to all staff members who will be working in a workplace, protecting them from exposures, risks, and reminding them of precautions that they are supposed to take. I believe everyone is responsible for their safety and health. On the examples of the health and safety is for us as nurses, we need to wear professionally, especially when we are on duty. We need to wear flat shoes in case of emergencies, so that we will not be limited in rushing in and out. Secondly, we need to tie up our hair and not leave it dangling, because a patient, especially a confused patient, may try to pull the hair, which is danger to staff or to self. Lastly, I can say we need to, on the patients who are on restraints, we need to make sure every time we leave the restraints on for them to prevent from falling from bed, especially to those who are restless.
Thank you, Betty. Next question. You have a Muslim woman going to the theater for a D&C post-mid-trimester delivery for retained product of conception. As you prepare her for theater, she refuses to take off her hijab. How would you manage this?
As a nurse, I will respect her decision. I'll ask her why he's refusing to take off her hijab whilst I'm listening attentively. Then I would also communicate with her effectively on the hospital policies and regulations for people who will be going to theater, that they are supposed to be in theater attire to reduce the spread of infection. I would also ask the patient for the things that I should do for them for her to feel comfortable in removing his hijab. I would also reassure her that maybe she should, I'll give an advice, in fact, that she should remove it whilst she's about to enter the theater room, and after that, I'll hand over to a female nurse as well who will put his hijab on after the surgery. If possible, or if there is any other Muslim liaison nurse, I would ask them to come and have a chat, talk with the client. That's all I can do for her.
Thank you, Betty. Next question. You have a 12-year-old Aboriginal girl from a remote community on the ward with query appendicitis. The RMO advises that he thinks her appendix has ruptured and that she will need to go to theater ASAP. Her mother has gone uptown to do her Centrelink, banking and shopping. How do you manage this situation? I
will prepare the child for theater, since the gravity of the sickness calls for a quick decisions. I'll ask the doctors, since the 2 doctors are allowed to sign the consent, so that they can sign the consent for the child, and the child will go to the theater. Since we also have got we would have the records for the mother. When the